Hello everyone, I'm Dr. Archita Goyal. Welcome to Decode, where we crack the code behind every radiological scan. Don't forget to like and subscribe. Let's decode together.
Here we have a 9-year-old child who presented with right hip joint pain. The child was being treated with for right psoas abscess. So here you can see I have three images. This is T1 weighted coronal, PDFS sagittal and PDFS axial image. You can see here there's a large altered signal intensity intramedullary area in the proximal metadiaphysis of the femur along with permeative pattern of bone destruction. You can see little bit of periosteal reaction is there. On the T1 weighted image, you can see that there is a sinus tract or intramedullary cloaca, and then cortical breach is there in the lateral as well as the medial aspect. Also, I can see a huge collection here in the adductor group of muscle. Right, another small collection is here. This can be correlated on PDFS images, the collections you can see here as well. Right, and there is no intra-articular extension of the disease. So this is a classical case of chronic osteomyelitis of the femur. Very important take-home point here is whenever a child presents to you with similar kind of picture, there is a very important, there is another very important differential diagnosis, that is Ewing sarcoma. But this is a very classical case of osteomyelitis. So always think of infection first in a child where permeative pattern of bone destruction is present. Thank you so much.